Hello everyone, welcome back to Health Haven with Dr. Kelz. Today, I'm diving into a topic that's surrounded by numerous myths and misconceptions. I am talking about lupus. Before we bust some myths, let's quickly remind ourselves what lupus actually is. Lupus is a chronic autoimmune disease that can damage any part of the body, from the skin to internal organs. In lupus, the body's immune system becomes hyperactive and attacks normal, healthy tissue. This results in symptoms like inflammation, swelling, and damage to joints, skin, kidneys, blood, the heart, and lungs. If you haven't already, check out our previous video unveiling the truth about lupus for a foundational understanding. Now, let's tackle some common myths about lupus and set the record straight with facts. Myth number 1. Lupus is a rare disease. Well, lupus is not as rare as you might think. Over 5 million people worldwide are living with lupus, with several new cases diagnosed each year. Experts believe that the number of lupus cases is underestimated, so there may be many more people with lupus out there. Myth number 2. Lupus is a form of cancer. Lupus isn't a form of cancer. It is classified as an autoimmune disease in which the body's immune system starts attacking healthy tissues instead of foreign invaders and infections it was designed to fight off. Myth number 3. Lupus is contagious. Lupus is not an infectious or contagious disease. You cannot catch lupus from someone else, either by hugging, shaking hands, sharing food, or through sexual transmission. Moving on to myth number 4. Lupus is always fatal. Even though lupus is a disabling and potentially fatal disease, with today's medical advancements, most people with lupus can lead a normal lifespan if properly treated. Myth number 5. Lupus only affects older adults. Lupus can affect any age group, including children and teenagers. However, it's most commonly diagnosed in individuals between the ages of 15 and 44. Next up is myth number 6. Lupus only affects women. While it's true that lupus is more common in women, particularly during childbearing years, men and children can also be diagnosed with lupus. Myth number 7. Women with lupus can never get pregnant. Lupus doesn't prevent women from getting pregnant, but it can cause some complications in pregnancy. Many women with lupus can have successful pregnancies with proper planning and monitoring. In fact, 80% of women with inactive lupus can have successful pregnancies. Myth number 8. Lupus only affects the skin. Actually, lupus is not just a skin disease. It can affect any part of the body, including the joints, kidneys, heart, lungs, blood, and brain. Now, moving on to the 9th myth. Lupus can be cured. Well, currently, there's no cure for lupus, but treatments are available to help manage symptoms and prevent flares. Treatment typically involves medications to reduce inflammation and suppress the immune system. Myth number 10. Everyone with lupus has the butterfly or malar rash. While a butterfly rash is a classic sign of lupus, not everyone with lupus develops it. Only about 1/3 of people with lupus develop this rash. Other conditions can cause a similar rash, so its presence or absence doesn't definitively indicate lupus. And finally, myth number 11. Lupus runs in families. While some people with lupus have family members with the disease, only 10% have a close relative with lupus. Genes likely play a role, but environmental factors may trigger the disease. Not everyone with lupus has a family history of the condition. There you have it. 11 myths and misconceptions about lupus debunked. Understanding lupus is crucial for dispelling stigma and misconceptions around it. I do hope I have succeeded in setting the record straight by stating the facts. If you found this video helpful, don't forget to like, share, and subscribe for more myth-busting and informative content. If you have any questions or any topic you want me to discuss, feel free to drop a comment, and I will respond. Until next time, stay healthy and informed.